Interventions designed to help the caregiver become a more competent and confident provider are important to ensure that the patient receives safe and effective care. These interventions are aimed at preventing abuse and neglect, improving the caregiver's knowledge and skills, supporting caregivers with early identification of patient problems, and managing patient care. They develop psychomotor skills for the safe administration of medication and use of equipment, as well as enhancing emotional and coping skills to deal with the caregiver's anger and frustrations. In 2009, a Putting Evidence into Practice team that studied caregiver strain and burden did an extensive literature search and classified interventions under the following categories: recommended for practice, likely to be effective, benefits balanced with harms, and effectiveness not established, and effectiveness unlikely and not recommended for practice. The following interventions are recommended for practice: cognitive behavioral interventions. Change caregivers' perception of their ability to control a situation and teach caregivers to monitor themselves for personal distress and employ strategies to manage it. Nurses can change negative assumptions or thoughts, help caregivers develop problem-solving skills, focus them on managing their time and their emotional reactions, encourage them to participate in pleasant activities and positive experiences. These interventions are likely to be effective: psychoeducational interventions, psychotherapy interventions, supportive interventions, and multi-component interventions. Psychoeducational interventions are individuals or groups partake in structured programs that provide information about the disease process, resources and services, or training about the disease and treatment. Psychotherapy interventions include a trained professional works with the caregiver toward the same goals as cognitive behavioral therapy. Supportive interventions: individuals or groups build rapport and discuss feelings, problems, and successes in caregiving. In multi-component interventions, combining interventions may be more effective than a single intervention because they use several techniques and address a variety of needs. Multi-component interventions may be more effective with older caregivers, those helping older patients, female caregivers, and those who report a greater burden. The North American Nursing Diagnosis recommends the following interventions: encourage caregivers to identify family who can assist with caregiving. Successful caregiving should not be the sole responsibility of one person. Encourage involvement of other family members to relieve pressure on the primary caregiver. Caring for a family member can be a mutually rewarding and satisfying experience. Suggest the caregivers use available community resources, such as respite, home health care, adult daycare, geriatric care, housekeeping services, Meals on Wheels, companion services, and others as appropriate. Encourage caregiver to set a time for self, to relieve stress and to maintain their own identity. This could be as simple as a relaxing bath, reading a book, or going out with friends. Teach caregiver stress-reducing techniques. Reducing stress will prevent adverse health effects and improve perception of caregiving. Encourage caregiver and support group participation. Groups that come together for mutual support can be beneficial in providing education and guidance. Acknowledge to caregiver the role he or she is performing and its value. Caregivers have identified how important it is to feel appreciated for their efforts. Encourage care recipient to thank caregiver for care. Feeling appreciated decreases strain. Provide time for the caregiver to discuss problems, concerns, and feelings. Ask how he or she is managing. A nurse as a caregiver is an excellent position to provide emotional support. Inquire about caregivers' health. Checking blood pressure and performing other health checks identifies adverse effects of stress, solidifies the importance of caregiver maintaining good health, and provides support for the caregiver.